computer? Okay, right. We should be recording. And then, Bron, I'll just Dropbox you the recording.
Yep, sounds good.
Cool.
All right.
All right. Is someone else coming? There we go.
Lovely.
Cool. So I put, does everyone know there's a chat window? Down at the bottom is your like Zoom control. So one of them is a chat box. So I've just put in there, you know, if we can just all stay on mute unless you have a question, in which case unmute yourself and ask away, or you can ask in the chat box if you prefer. And I think everyone has their real names, which is nice. Otherwise it just says, like, if you don't change your name, it just says like iPad 2. And it's just nice having real names. I think that's it.
I wish I had a fun name. I should have went under an alias, something fun.
You can. It's not too late. Just the upper right corner of your own face window are 3 little dots. If you click on that, there's a drop down that says rename. So you can.
Nice. Huh. I won't do that.
Next time. Maybe when you're not hosting, then you can go as an alias. Yeah. Okay, well, I'm going to turn it over to Bron then, if that's cool with you, Bron, and I'm going to mute myself.
Well, hi. Some of you look very familiar. I'm going to be talking today about a few little things. I want to start off by talking about what actually osteos do and what, you know, where we are in the role of birth, because I think that's really important to establish first, and then we're going to run into just a little bit about optimal alignment in pregnancy, and then talk about, which made me laugh, just breastfeeding neck. I just love that as a diagnosis. I think that's hilarious. And I use it all the time because it makes total sense. Everyone's like, my neck is stuck like this because I'm down looking at my baby. So we'll talk about strategies with that, why it exists, and what to do if you get a little flare up. But we'll start off with talking about what osteos are, because some of you may not know. Basically, we're university level qualified allied health professionals. So we're trained to diagnose and treat musculoskeletal conditions. We consider the body as a whole. We look at how all those body systems interrelate. So if you come into me and go, my neck's sore, that's great, I'll look at that, but I want to know, how's the upper back moving? How's the lower back moving? How is your breathing pattern? So there's a lot more than just focusing on the symptomatic pain. And I want you to kind of teach yourself, if you do get pain and you can't get into a manual therapist, you know, is there other areas that are associated with this? So you tap into the area you think, okay, that's sore, but what else is tight? If I bring my awareness and I broaden that awareness, where else am I feeling tight? Oh, I'm kind of bent in this direction, so maybe I'm straining on the left. So have a bit more awareness around just, rather than just on that symptomatic area of pain. And that's how osteos think. We still treat that area, but we're still looking at, you know, compensations around, you know, especially with pregnancy, there's so many biomechanical changes that happen the whole time. And you all know that. You're like, why do I feel like this at 20 weeks now? And at 16 weeks, I was totally fine. There's just so much change happening through that body. And our role in birth is more about supporting you, your obstetric and midwifery services. We provide education on the changes that are occurring through your pregnancy. A lot of women just don't know, and that's totally fine. And we treat the conditions that your obstetrician or midwife might not be well trained to treat. So things like, you know, sacroiliac joint pain. So the 2 dimples in your lower back, that kind of area. Lower back pain, pelvic girdle pain. And we're kind of there to flag issues throughout your pregnancy that might be prevalent in your postpartum period. So when I see a woman in clinic, I'm always thinking, well, postpartum, how are they going to feel? What do I have to flag now so that they don't have all this horrendous pain after? So we work towards your well-being goals, getting you back into fitness, that kind of thing. So once you have the baby, definitely, you know, video consult, which is now the new thing, or see a manual therapist like an osteo to discuss how you're going to get to those goals. And we also keep lines of communication open between all practitioners on your birthing team. It still constantly surprises me how many people just don't talk to other practitioners. No one knows what's going on, and the woman's in the middle going, I'm really confused. So make sure that if you have a practitioner that we're all communicating. And then in the postpartum period, our role is to look at your breastfeeding ergonomics, and that includes bottle holding, all that kind of stuff, your latch issues, and any postpartum musculoskeletal conditions like carpal tunnel, so wrist pain. And I call it cervical facet sprains and trapezius myalgia, which is a fancy term for breastfeeding neck. So yeah, does anyone have any questions at this point? Because I'm going to move into optimal alignment, and I just want you to let you all know I have, because I'm a Capricorn, have written a PDF because it's just too much to remember. So I've put it all in a fancy PDF, so don't feel like you need to scribble everything down right away. Just so you can refer back to and go, oh, that's the stretch she was talking about. So any questions? I'm just going to have a sip of my coffee.
Do you want to screen share the PDF? Do you have it open?
Yeah. My sister did tell me about this now. I forgot what to do.
So if you go down to the bottom of your
the giant green button in front of me.
Green thing, yeah. If you click on that, and then it should show you every window that's open, and then you can just choose the PDF. All
right. So, okay, here we go. Ooh, this is fun. Yes, there it is. Yes, we got it. Okay. Can everyone see that? Yeah, cool. All right. So we're going to move into optimal alignment in pregnancy. And I've kind of put this picture there. It looks so weird now that I look like an alien, but that's not what you all look like. But we need to talk about, in terms of alignment, we need to talk about changes. What actually changes? And I'm going to totally just blow you out of the water by saying, guess what? There's no optimal posture. There's no protocol. There's nothing. Because your body is completely unique. It's unique to you. Your compensations are unique. There is no protocol to say this is the perfect posture and this is terrible. Everyone who talks about good and bad posture, I just stop them straight away in clinic and go, can we not use that language? And I think Caitlin would know absolutely how important language is when we're talking about pain and birthing and all that kind of stuff. It's really important to go, oh, you know, that we don't go, I've got terrible posture, it's terrible. It's not. It's just your body is compensating in a different way to somebody else. So when we look at this little picture here, which I borrowed from Caroline Stone, who is like, I fangirl her really hard because she's an awesome women's health osteopath in the UK. This is from her book, Visceral and Obstetric Osteopathy. And she's kind of put the changes here in a really simple way. So I'm going to talk from pretty much the bottom up, because then we're going to talk about how to get best optimal alignment from here. So we can see that you've got a tilt happening in the pelvis because of the size of the uterus. It expands. We get a strain in the abdominals. So that's where we start to see the separation happening. Because of that expansion, we get a lot of pressure on the pubic bone. So that's when women come in and say, I've got pelvic girdle dysfunction or SPD or symphysis pubic dysfunction. And so with that tilt, there's a lot of pressure and a lot of inflammation on the ligaments. You get a lot of sacral nutation, which is a fancy word for tilting. And that's this little bit here is like the lower back muscles, either side of your spine, they start to compress because they have to counteract what's happening at the front. Everything works together. It's amazing. And it's really, in pregnancy, it's really predominant. It's like you can see how well bodies compensate. You also get kind of tilting through the legs. So you get tightness in the hamstrings, tightness in the calves, and tightness underneath the feet in the plantar fascia. We also get a really big strain happening through our diaphragm. So that's when I see a lot of women saying, got reflux, it's terrible, what's happening? And I do a diaphragm release and they're like, oh, I'm not spewing into my mouth anymore, which is just great. Then we also get a compression up the top through your clavicles, so through the collarbone, in through here, that becomes really compressed. And that's a major house for lymphatic drainage through the body. So this is where women come in and they might have swollen fingers, swollen legs. It's just because everything is slowing down a little bit, it's working really hard. We also get strain through the neck. So we kind of end up with that forward head posture. and a tilt in the head. So we get a lot of compression at the base of the skull. So tension headaches, things like that become really predominant. So does anyone have any questions about that drawing? Because it's really, it just summarizes what's happening in pregnancy for the average person. No, we're all good, makes sense. Cool. So yeah, that'll be there to kind of refer back to, and I want you to kind of think, well, what's my body doing? Where are my strain patterns at? What do I have to bring my awareness to, you know, throughout this pregnancy to stretch more or move more? So just going to roll down. It's like a wall of text because I just couldn't stop writing yesterday. So with alignment tips for pregnancy, if you're still working at a desk, if you're still working, you know, well, we're all working at a desk, but you know what I mean. If you're, hang on, I'm just going to turn my TV off. I think I have a ghost in the house because my TV just turned on, freaked me out. Sorry, guys. So what was I talking about? So work desk setup. So I have this saying in osteo, motion is lotion, which is kind of weird now that I think about it, but it's actually true. If your work desk setup is really cramped, it's really short, you know, there's not enough room for you to do things, we're going to have a problem. You need to set up your work desk efficiently. It needs to be good. You need to have everything in an ergonomic fashion. So today I'm on a laptop on a stand with a keyboard that's wireless, so I can set everything up to where it needs to be rather than crouching over and doing all that stuff. So if you have a standing desk, I always recommend these. They don't fix anything, but they just provide an alternative and some, you know, variability to your day. So when women are still working, like a lot of public servants are still in the offices and they have a hot desk situation, it becomes really hard, but definitely use it for a couple of hours, just intermittently through the day. It reduces pelvic pain because you're not sitting and compressing everything. You've got that ability to stand up and let everything drain and stretch out. But it reduces back pain, and in some women, it reduces reflux symptoms because we sit compressing our esophagus all day, our diaphragm. So I want you to ask yourself, what are the areas that are tight on me? Do I have any areas I've experienced a history of chronic pain in? So lower back pain, upper back pain, because these areas may already kind of be under a bit of strain. When we add pregnancy on top of that, they might not be able to cope well with the compensation. So just bringing your awareness and going, actually, that old knee injury may be something I need to be aware of and work at releasing my hamstrings every night or my glute muscles every night. Rather than just kind of waiting until something goes boom, just have that awareness about what's happening. This is a big one, and women are always like, no, but try not to sit cross-legged. I know, some of us just can't help it. Don't tuck one foot under the other. I do it all the time. I have to catch myself because when I do it consistently, I get like lower back pain. It just loads up the spine. If you can imagine like a man sitting on a big giant wallet in his back pocket, they sit like this. So the load and the tension up that spine can't compensate well with what's happening if we constantly do things through our pelvis. You kind of need to man spread a bit. Like, it's okay. So sit with, you know, it's both sit bones. Really bring that awareness when you sit down and go, am I tilting more to left or am I tilting more to the right, or can I sit better? Just straight away, women who come in with pelvic girdle pain, nearly all of them that I see sit cross-legged every day, or they tuck one leg under their bottom, and it just builds this compensation through the spine and it can't cope. So it goes pain, pain. Once we make those little everyday adjustments, it's usually okay. Sitting on the lounge is fine. People are like, I don't want to sit on a ball for the rest of my life, but I do recommend that you try to, from 28 weeks onwards, to get used to sitting on your exercise ball. So I think Kate said she's sitting on a ball, which is just amazing. I'm so proud of you. But it's good because you're so bouncy. Because if we sit all day on a hard chair, we're compressing our pelvic inlet to be really small. We're bringing the sit bones together. So with sitting on a ball, you're allowing your pelvis to kind of relax and drop down. We're creating space for the baby. But also, in second stage of labor, it's really important that, you know, your sacrum's able to, so your sacrum's kind of like your, where your tailbone is or just above, that your sacrum can tilt in this fashion. So it kind of does this motion and it helps with the baby's ejection reflex. But, you know, if we're sitting all day and we just sit home and we kind of sit in a C shape and compress our pelvis, then we're not really encouraging the sacrum to move. How the hell are we going to expect it to move really well during labour? So I often say to women, really get on the ball, practice your pelvic tilting forward and backwards, your pelvic rolls around in a circle, and use the ball, because we can't run a marathon if we haven't at least practiced a couple of runs. You're going to get the exercise ball and go, I don't know what to do with it. What am I doing with it? I'm not comfortable with it. Like, it needs to be your best friend. You need to use those tools throughout your pregnancy. So when it comes to labor, you're like, sweet, I know what works for me. And then you'll just be more in touch with your body as well.
Hey, Bron, can I just jump in? There's a few questions in the chat box. So can you use an exercise ball incorrectly?
Can you use it incorrectly?
Yeah.
Not really. I don't think so. What do you think?
No, I mean, as long as it's not hurting, like, you know, obviously if something's causing pain, then don't do that.
Yeah. No, I reckon it's fine.
How about sitting cross-legged when not pregnant? Does that cause the same?
People are going to hate me for
this. This is actually not for me. I am sitting cross-legged right now, but.
Just don't do it. It causes it. It is an issue. It is an issue for women. We do it because it's a comfort thing. It makes us look relaxed. You look casual. You know, it's just, it still will have the same effect through your lower back and through your hips. It's just even more prevalent in pregnancy. It's a really big problem. It gets to a point where you can't, like most women get to 28 weeks and go, I just can't do that anymore. But they still sit funny and they still tuck their foot, and it just causes too much pelvic strain. So I really advise against it.
All man spreading all the time.
Yeah, 100%.
Okay.
This is our time.
I think that was all the questions. So
okay.
Yes, thanks back to you. Thanks.
Alrighty. So one last thing on the alignment is I talk about, and we do talk about this in osteo quite a bit, about the spinal junctions, which sounds really creepy, but the spinal junctions are areas where certain parts of the spine meet. So we're talking about where the neck meets the upper back, where the back meets the lower back, and where the lower back meets the sacrum. So see what I mean? There's the 3 junctions there. My tip is you need to keep the junction zones moving. So I'm talking about the hump. A lot of women go, my hump. That's the cervicothoracic junction. You need to keep it moving by doing things like trap stretching, yoga posing, looking up, looking down. So things like that. Your mid back, where your back meets your lower back, lots of rotation movements are great for there. We lose a lot of rotation in pregnancy because we're so anterior. We lose that ability to kind of reach around and do things. So keep that rotation happening through the middle. And as for your lower back meeting your sacrum, you need to do lots of pelvic tilts to keep it happy. Okay, so if you think, okay, well, I'm going to work on my 3 junctions and just every day do something for them, that's going to make a huge impact. So from an osteo perspective, when women come into clinic and they've got stuff happening top to bottom, I don't want to do 100 different techniques to them because they're going to walk out feeling like they've been hit by a bus. I usually, and this is an inside for most of the osteos, I usually go for the junctions. And I go, well, if I can get those big guys moving, how will that impact all the little ones in between? So I hope that makes sense to people, but I've put all that in the PDF if you want to look at where they are and how to get them moving. But most of the time, people that do yoga consistently are pretty good. Like their junction zones are moving really well. So we need to move. That motion is lotion. If we're not moving, things are going to get stiff, tight, compressed, and sore. So the exercise tips I have for that, I put just basic ones in there that you can Google because We don't want weird ones that we'd have no idea what's going on. But I put things like cat-cow yoga pose is always a go-to for ones that I give to women. Absolutely essential. Essential. Because it lengthens your spine. It lengthens the muscles along the spine, which are, as we go back to that picture, this guy up here, guess what's happening? They're all shortening. They're all getting really tight. So we need to lengthen them. So cat-cow's great for that, but it also gets your pelvis learning to tilt forward and backwards, forwards and backwards. So I really like it. Plus, it's also a bit of an inversion technique where you're on all fours. It's really important that you do a little bit of floor work where you encourage that so baby has some room to move in there. The more you do on your hands and knees and inversion techniques where we're a little bit like that on all fours, it encourages pelvic space and baby to move a lot more. So this is great for women that have baby that's not in an optimal position. Cactus pose is another one. I know Caitlin loves this one. But over a rolled up beach towel, you don't need a fancy foam roller, but just a rolled up beach towel. You place it along the middle of your spine, so upper back spine, lift your knees up together, and you just stretch out like a little Mexican cactus. So like that. So it opens up your chest, which is really tight. This is great for people who have anxiety. It stretches out your anterior fascial line. So from chin to belly button, it gets it to expand because it is quite contracted in pregnancy. So I like it for if you've got a little bit of refluxy stuff happening or you've got anxiety. It's really, really good. The other one, am I right to keep going? Does anyone have questions at that point?
I have a question.
Yes, darling.
Did you say roll the towel along the spine or across the shoulders?
Along the spine, so vertical.
Right.
Yep.
Yep. Thank you.
That's okay. Now I do get asked that a little bit because people are like, but you know, my back can crack if I do that. You know, I can put it over. Don't do that because it's going to really localize the force to that one segment. Most women that do, like, they lay over a foam roller that's lengthways, that's, you know, that way, it compresses it and they kind of go, oh, that's a bit too sore. So keep it long, keep it along the spine so that it's more of a general pressure rather than localized. I'm really not a fan of foam rolling into extension like that up and down the spine lengthways because it localizes pain. So it's not really my thing and I don't recommend it. The other one that I get asked a little bit when I give this out, I gave this out to a pregnant lady a couple of weeks ago and she's like, why am I rolling a tennis ball under my feet when I have pelvic pain? I was like, welcome to osteo. The reason I give that out to women is because if we go back to this picture and remember how I said the pelvis is tilting, our hamstrings are tight, and the bottom of our feet, the plantar fascia usually sits in this nice little curve. Guess what? It's now flat. And that absorbs impact when we walk. And if it isn't bendy to kind of do the trampolining action, we've got no movement. And where does that force go when we walk? To your lower back and your hips. So I usually say to women, I need you to do this every day while you're sitting at your desk. It doesn't matter. Rolling the ball under your arches of your feet, just back and forth. And I'm not going to put a time limit on it. I never do that. Just do it for however long you have or what's comfortable. It releases the plantar fascia, but also releases pelvic fascial tension. So if you can imagine a sling or an exercise band from your pelvis down the hamstring, down into the calf and under the feet. This is where women go, why am I getting cramps at night? Because everything is starting to contract. Plus blood flow down there it's not 100% right now. It's getting a lot of pelvic tension and a lot of pelvic congestion because you've got a lot more blood to try and get around the body, but it's not getting through because of how heavy that pelvis is and how much under strain that is. And it increases your circulation and your lymphatic drainage. So it's going to help with the puffy feet and the stiff feet and all of that kind of stuff. I give this to a lot of endo women who come in really cramped, you know, they're really bent over in pain, and I understand that, but I give this to them and they're usually feeling a lot better after. So just by doing that, that's all. So if you're having an off day, at least do that. The other one I give people a happy baby pose. So that's kind of when you're on your back and you bring your feet up a little bit usually, and you can get your partner to help if you're like, I just can't do that. They can actually get you into that position and you just hold it. or single leg hugs where you bring a leg up to the chest and then the other leg. And I usually recommend that on the bed. Don't do it on the ground. It's too firm. The bed's nice and comfy. You can support your head. But yeah, that's really good for kind of helping open up the pelvis and the pelvic tissues. It's really important. The other one is sink squat. So it's just a deep, like sumo squat. You have to be really careful if you have a pelvic organ prolapse with this. Just be gentle. But I want you to use that exercise ball and kind of have it in front of you, or a dining room chair or something to support you. And you just get down into that squat position and breathe. Like I said, motion's lotion. If you're not practicing these techniques, how are they going to be useful in labor? If you're not comfortable with opening up your hips, you're going to get to, you know, that labor room and go, oh, I don't know what's comfortable. I'm embarrassed. Or, you know, like things like that. I have women that are uncomfortable in my clinic with opening their legs up, that I get them facing a wall on an exercise ball and get comfortable with man spreading, because they're so used to sitting cross-legged and being reserved and keeping everything tight. Guess what? You need to practice it. So if you're worried about it, then do it facing a wall or do it in a room and just get comfortable with opening the hips up. Because the more comfortable you are with it, the more it becomes a tool you can use in the labor room. Do you have any questions, Caitlin? Keep going. Yep. The next one I've got is just the simple hip stretch, one we've all done. You're just sitting in your chair, you pop an ankle over the other knee and you bend forward and you're just stretching your glute muscle. It's really important. It's really easy to do, and you can do pigeon pose, but it's a little bit more advanced because it requires, if people are quite bendy, I usually recommend pigeon pose because you can get down into that position and do it. But if you're quite stiff and you're not comfortable with getting on the floor and getting up off the floor, then just the little hip stretch seated is fine. So kind of the last little bit of this and the essential exercise tips are, the single best tool you've got is your breath. I can't emphasize that enough. We have this quote in Osteo by the founder, A.T. Still, that you live and die by your diaphragm. Your diaphragm is so important and it correlates with your pelvic floor. They work synergistically, they work together. So if you are quite an anxious person, you chest breathe a lot, so all up through here, we've got tight neck, tight shoulders, tight rib cage. To get them to breathe down into their diaphragm, which lives under kind of where your breasts are in a dome muscle, if you're not working that effectively, then how does your pelvic floor work with breathing? It kind of just stays. It stays like that. But when we use diaphragm, it kind of starts to do this motion, which when you think about how important is that? Like, we need the pelvic floor to be able to move. So I want you to really think, if I don't have time for anything that Bron said today, I just can't find time to do all this stuff, the tool you need to do and use is your breath. You need to start working on diaphragm breathing. And I've popped a really cool little video link in the PDF where I kind of went through YouTube World yesterday trying to find someone who really explains breathing and pelvic floor well. And she did a really good job. She's a pelvic physio. And I thought, yep, she's done a good job about sitting, you know, and it is actually instructing you rather than just breathe deeply. Like, what does that mean? So she actually takes you through how to do it. And I've also popped down the bottom, because I do give this to mums who I find either have a really tight hips and pelvis, or bub's not in an optimal position at 34 weeks, or, you know, all that kind of stuff. It's spinning babies. And as much as the title's like, what? It's actually it has so many great resources for optimal birth. So I popped the daily activities one in there because I thought that's really good. It shows you how to do things on all fours, how to do a little bit of basic inversion. And if you sit a lot for your job, you should be doing that every day, because it's allowing your hips to be in optimal position, allowing bub to move around in there without getting compressed, because I treat the babies on the other side who have little uterus strains, you know, who were stuck in a position for a long time. And that's fine. It's not a problem. This happens. But if we can create as much space, then there's more, you know, it's less likely they're going to have a bit of feeding issues and flat head and torticollis, which is tight neck. Because, you know, imagine being cramped in a box. Like, they're just like, help us. So they come out the other side, they're like, Brad. And it's easy, but just create optimal space. I'm going to move on. So do we have any questions?
Can I jump in, Bron?
Yes.
So the whole point of optimal maternal positioning, so you get your pelvis well aligned, which means that your uterus is well aligned, which means your baby's well aligned, and so that usually leads to a more straightforward birth. If everything's lined up and your baby has an easy path out, it's much easier for you, it's much easier for your baby. But if your uterus is if your pelvis is torqued, then the way your uterus sits in your pelvis is torqued, and then your baby's torqued, and then you have this much more complicated path for baby to find their way out. So that's why, you know, Bron does what she does, and we talk about this in hypnobirthing as well, is good maternal alignment leads to good fetal alignment, which usually leads to a more straightforward birth. So it's definitely worth the effort. You know, just committing to these exercises, you know, even if you can't do them every day, like, we're all under a lot of stress.
Yeah.
We don't want to be adding more stress to anyone's lives. But if you can just kind of, you know, just be like, oh, actually, I have a tennis ball. Like, yeah, today I will grab the tennis ball and do a few circles under my feet. You know, just do what you can do what feels good. But every little bit does actually have pretty significant impacts.
Yeah, perfectly said. It's so true. And quite often, like, and I often talk about this in clinic, that mother's instinct is just like, it gets, in our society, gets thrown out a little bit. We want to know the facts, and we want to know what's happening and what the research is behind things. But when women come into my clinic who are pregnant, they go, I just feel like this is tight, I'm bending this way, my hips are doing this. And guess what? Nearly, like, I reckon 90% of the time when I do a physical assessment, that's what's happening. Like, you know where you're tight, what it's doing. If you actually tune into what's happening, you can help yourself get out of that situation. You don't, great to have hands-on treatment, but that's one tiny little section of it. That's me making a change at the tissue and getting a neurological change at the tissue. And then guess what? The rest of it's up to you. So tune into what's happening. You already know where you're tight, what's happening, and kind of try and step yourself through stretching that out. And that's what those little techniques are all about. But I often say that, like, you know what's happening better than me sometimes. I'm the person on the outside. Yeah, so we're moving into the last little bit, which is breastfeeding neck, which I'm forever going to term it now. I've just never thought about it that way, but it so is. It's really common. You get it from breastfeeding and holding babies and lifting toddlers and reaching up and grabbing things out of cupboards. I see it every week in clinic. It's kind of our bread and butter as osteopaths, lower back pain and neck pain. It's just constant. And it comes from weak and tight muscles, coupled with repetitive motion. So women go, but I don't do anything. Like, you know, what could it be? I'm like, you feed a baby 1,000,000 times a day in the same position, and then you lift your toddler up with one arm, and this is where it all comes from. So I usually give a little bit of tips towards their breastfeeding station or wherever they want to do most of their feeding. And I say, have your protein snacks in a flip lid container. You just press on and beep and have some nuts. Water bottle, and I often recommend a travel neck cushion on your breastfeeding station, which I know some of you are like, that's not going to happen. I'm just going to be feeding wherever I can, and that's fine. But the travel neck cushion just, you know, it allows for you when you're doing nighttime feeds or, you know, feeds that are going on for quite a while, but you're both in a really comfortable kind of synergy at the moment, pop the neck cushion on so you can relax back. Don't be like this for 100 million hours. If the latch is on and you're comfortable, you've had your little look and you're happy, then get the neck cushion and relax back into it. It stops compression like this happening. It's going to be more of that. So I say for the longer feeds, the comfortable feeds, use the neck cushion. It's so good. And also make sure you've got a breastfeeding pillow for bub to be propped up on if you're doing like cradle feed or whatever. And have some back support. Have some pillows to support your lower back and upper back. If we have tight, compressed mid back, that kind of it kind of makes feeding a little bit difficult because the nerves that are in that mid-back supply the breast. So when women have mastitis, their mid-back is really stiff. It's what we call a viscerosomatic referral between the two areas. So keep it nice and stretched and happy, and keep it supported so that you have great flow, you have great muscle contraction. That's kind of like a little tip as well. And then I often say, if you have neck tension or you have a little bit of a neck spasm, I usually recommend the Australian hold or the koala hold. So where Bub's kind of straddling your knee and you just press them straight on. And I give it to women who are finding a lot of latch issues with Bub, you know, in a cradle or a football hold. It's just not working. I'm like, just literally put them on your knee. And Bubs that have hip dysplasia, this is awesome. You just put them on your knee and press them straight in. And you might have to lift and press, and that's fine. But it just stops this from happening. So if you're really flared up, your knee is taking the weight of the baby and you're just pressing Bub straight on. Easy. And you just stay there like that. You support with your other hand. In my fake baby world. I should have brought something. So I like that for when you've got neck spasm or tension. It's just easy. So get comfortable in the early days of, you know, a few little different feeding techniques. There's heaps out there. And lactation consultants are fabulous. They always kind of get you thinking outside the box with feeding and positioning. Don't be stuck thinking this is all I've got. Don't Google it. Get some advice, but get someone to actually look at what you're doing, because it's really good to have the outside opinion because you're in your bubble and your husband's going, I don't know what to do. So you need that outside perspective sometimes. And I don't know how many women I go, just do this. And they're like, oh, wow, I didn't even think of that. And that's fine. It's just a blur, but it's good to have that help as well. And LCs, I know at the moment, are doing a lot of video consults like me. It's easy. We can see what's happening, and we can help. So another thing for breastfeeding neck is the heat pack is a go-to for muscular strains. Do not put ice on a neck. That just creates a lot of tension. I like for your neck heat to keep it happy. And I never really recommend ice for necks. Usually other parts, but not that. And then another little go-to stretch for this is just a couple of these is I give this to office workers, people who sit at their desk a lot, mums and bubs who are feeding, is the little seated trap and levator stretch. So we can do it all together now. It's pretty good. You sit on one hand. So if we don't sit on one hand, you end up with kind of like a trap that's kind of doing this and not allowing the stretch. So we sit on one hand, or you hold on to the bottom of your chair. And with this other hand, spirit fingers, we place it on the side of our head. And I want you to push that shoulder that's grabbing on down. And I want you to push and pull at the same time. So see how much it's a more effective stretch than if you didn't have that there. Because feel the difference. If you're not tractioning that shoulder down, how different does that feel? It's not as effective. So I want that to be step one. And then I call it sniffing the armpit, but we rotate the nose to the armpit. The angle of the hand changes from here to more towards the back and down. And feel that stretch. So we're sniffing our armpit effectively. Good. I'm watching. Good. That's a different area. So when we've had a lot of carrying, a lot of feeding, that's a really easy go-to stretch for that. The other one I want you to do is interlocking your fingers like this, placing it on your chest. When you place them, I want you to place them on the chest and traction down. So push down a little bit. So you have almost a stretch through here. And I want you to look up and across. So up and ear to shoulder. And then the other side. And it's really good because it loosens up all of this fascia that's been stuck in tension looking down. So I give it to people with headaches, anxiety, because it's a lot of the tension through here, and a lot of feeding issues. The other one that I always give, and jaw pain. That is so good for people that get TMJ pain, to really stretch what we call the sternum. So it's pressing in, down, up and across. And we do the other side, and you can rotate. Do what you feels right to get the release through there. The other one is thread the needle. That's a go-to yoga stretch for most of my mums, I just think when Bub's doing tummy time or floor time, please just spend 2 or 3 minutes or however long, the 15-second, little tummy time that they're like can tolerate, get on the ground and do just one side of thread the needle. If there's another tummy time opportunity in the afternoon, the other side thread the needle, because that's going to help with your upper back mobility that's been stuck. It's going to help with your diaphragm that's stuck because you're sitting all day, or if you have anxiety. And I often say, do most of your stretches if you can, while Bub's happy on the floor, you get down. It's such a good encouragement. They learn from day one how important movement is. And then finally, last little bit, if your neck is spasming, I want you to just stop and take a breath, because it is a normal protective response of the brain to the area. So there's nothing crazy going on most of the time. It's just tension, plus coupled with stressing out that we have the pain. So, oh my God. So there's more inflammation going to that area. You need to work on establishing your range of motion first. So if you're like, oh my God, I can't get in to see Bron or osteo, I can't rotate and look over my shoulder, what am I going to do? The first thing you're going to do is freak out. You're going to be like, oh, what am I doing? Well, how do I lift my baby? Oh my God. Just breathe and start doing this. So you grab your fingers and you put them either side of your jaw. So I want you to imagine you've got I call it the eek zone. So when we go, oh, I can't look that way, that's the eek zone. We go either side and we just go left, right. We go to happy zone. So when if you've ever had a neck sprain or a cervical facet joint sprain, this is about all you've got. And you just keep doing that, and then eventually you'll be able to go a bit further. But we never go to the eek zone. Don't push it, and don't stretch it until you get happier with that range. Okay? So that's step one. Don't go to the eek zone. If you get the range back a little bit, pop some heat on and try again with the heat on, because that'll help the muscle strain. And then you need to just keep hydrated. You can have a Panadol if necessary, or an anti-inflammatory if you can, if it's appropriate and necessary. And then you need to communicate with your partner that you might need a little bit of help for 72 hours. So you might need help from them with lifting Bub or toddler up every now and then, just until that inflammation and the strain reduces, which is usually 48 to 72 hours for that. So you need to communicate and say, I need you to help lift and carry just while this settles down. That's all I say. Don't use crazy words, just while it settles down, and keep working on your range, keep doing a little bit of upper back mobility to keep it happy, and try not to be forward head. Try and keep your chin back, because if we're constantly forward, we're constantly tightening those muscles. So head back, double chin. It's nice, like Wilbur the worm. So once you get that range back, you'll feel less anxious, because you'll be like, okay, that's better. Then you can start stretching a little bit. So you can start doing that little thing that I talked to you about. You can start doing thread the needle without feeling worried. And then once you get to that point, you need to stretch for the following week. So don't think that, oh my God, I'm out of the woods. Yay, I can drop off on all my activities now. No. You need to stick with it for at least a week, because they have a tendency to re-sprain, and it'll be through the most stupid thing that you can't believe that re-sprained it, but it happens. People are like, I reached and grabbed my handbag and it's back to square one. And that happens, but it's just the body going, I'm not quite ready for that yet. And then you just go back to step one, get your range back, get the heat on, take the Panadol, keep hydrated, and then we do some stretching when it reaches comfortable. So yeah, that's pretty much how I talk people through neck spasm stuff. But yeah, that's all I've got. And then if you need more support, I'm more than happy to do a video consult and talk about things with you, because this is a very general plan. It's not going to work for everybody. But I'm more than happy to do that. And when I'm up in clinic, yeah, come and visit. But over to you, Caitlin.
Thank you. Yeah, that was great. Does anyone have any questions related to what Bron just spoke about? Yeah, Kate, go ahead.
Oops, unmute. Okay. Yeah, Are there any ideal, like you said, you'll probably just sit down wherever you can to breastfeed, but
Yeah.
are there any ideal, like our couch is shocking, the back of it just slopes down and we end up doing that slouching
Yeah.
that you said on Saturday, that
Yeah.
isn't good for the alignment of the pelvis and
Yeah.
everything. Yeah.
Look, I'm just going to disclose, I'm not a mum. So I just see other mums going, oh my God, you are literally going to feed in every single position you can imagine possible in every corner of your house. But I can't recommend enough to have a little feeding chair. Have a little zone that's your zone, that's set up, that's got a nice diffuser, it's got a salt lamp. Like, I know this sounds crazy, but setting up your zone, it's so me, isn't it? Caitlin's laughing because she knows what I'm like. But you need a little comfortable chair where you've got, a blanket and you've got your breastfeeding cushion there, you've got your travel net cushion. It's really nice to have a zone in the early days to help with your posture until you get more comfortable with feeding, and you can go onto your lounge and prop it up with some pillows and things like that. You can find your little comfort zone there. But I really do recommend having an armchair or something like that. Yeah, I know that, and lots of them are secondhand, to be honest. Like, you can find some cool ones on Gumtree and Facebook Marketplace.
And you can work with what you have as well, but yeah, you do just need to assess, like, our couch was quite low. So particularly at the very beginning, I had quite a lot of abdominal separation. So for me, standing up was quite hard. So I needed to layer quite a few pillows, but I just had like little, my end of the couch that was always set up for me for breastfeeding. And I had a breastfeeding basket. So I just had a little basket that had pretty much all the things that Bron spoke about. And that way, if I wasn't feeding on the couch, then I could take my little basket. I didn't have the neck pillow, but I had snacks, water, my breastfeeding, whatever they call those, horseshoe pillows. I had one of those, and that way I could just take my basket wherever I needed to go. But yeah, I did find at first it was helpful to have the one place, and then again, you get used to holding in that place. You get used to how your baby latches when you're in that one place, and then once you get comfortable with that, then it's easier to adapt to different situations. Did you, Michaela, were you wanting to chat too? I'll mute myself.
Hey. Hi.
Sorry.
Is that me? Is that me you're talking to?
You're good. No, that's all good.
Did you have something to say, Michaela?
Oh yeah, no, I was just going to say, so my little girl, she's nearly 3. I'm obviously 28 weeks pregnant at the moment, but I actually fed her for 2.5 years. So we've actually not long stopped. My milk dried up when I fell pregnant. So so basically I had like a little setup here, like pillows built up, and I pretty much never ever held her ever. Because I got a lot of like neck and shoulder pain, and I was like double splintered for about 9 months after she was born. So in order to sort of, I guess, work around that, I just basically always sat on the couch, and then I would just have her resting on the pillow. That way then I didn't have to actually cradle her. And then obviously at night time, I've always just sidelined in bed to feed her. So I just, that was just a tip that, someone showed me in the beginning, and I just found it just helped alleviate a lot of pain. So
that's perfect. Well done.
Yeah, we can maybe, not to put Becky on the spot, she's here, but maybe we can do another, Becky's amongst other things, a lactation consultant. So maybe we can do another session, or Becky might be running some of her own, where we talk more specifically about breastfeeding, because it is a lot of trial and error at the start and finding what's going to work for you. Because I had friends who swore they like never fed their baby sitting up, they were always lying down, and I tried to do it and I could just never, like, I was desperate to lie down and feed, but I just couldn't, just didn't work for me. So it is a lot of trial and error, and I think doing the, whether you need a lactation consultant to come to you, or doing a video consult with a lactation consultant where they can actually see what your setup is and where you're feeding and how you're holding your baby in that space and what your posture is like all of that will give the lactation consultant clues, and they'll be able to help you based on that, your individual setup. Yeah.
Cool.
I'd love to. Awesome. And can I just say, hey, yeah, I'm a lactation consultant, but I'm a breastfeeding mum. So like you said, like this is my little, not so little baby. What I know very much firsthand that what I can offer someone or advise is different for everybody, because what I'm saying is not necessarily what I'm doing, because my baby's mouth is different, my boobs are different, every day is different. So yeah, it is a very different thing for everybody. So not a one size fits all for sure. But yeah, thank you.
Any other questions for Bron about anything else?
I think my sister wrote, do we not put our feet out on an armchair and just keep them on the ground? Okay. Look. The osteo in me is like, don't put your feet out. But then I'm like, I'm also human, and I think, God, just be comfortable. Like, if that's what works, just be bloody comfortable, because you might be there a while. So ideally, it's not great for your lower back to do that. But if you have enough support in your lower back with cushions and pillows and things like that, then that's fine. Like, don't be too harsh. It just means you might need to do a little bit of stretching later to counteract. But it's not naughty. It's all good. Anybody else?
Sorry, I just wanted to quickly ask, if you don't mind. I've got endometriosis, so obviously I've had like chronic pain for like many, many years, and I've always been told they have like a very like overactive pelvic floor. So my daughter actually had torticollis as a baby, and I do wonder now that you mentioned that before, whether or not that was to do with that. So that's interesting. But I'm just wondering, is there anything, because I'm going for a VBAC this time, is there anything, I guess, that I can be doing, like, or even maybe point me towards something I could be doing to try and, I guess, relax that area? Because I'm having a lot of like lower back and hip pelvic sort of pain. Yeah.
So thank you for bringing that up. I treat obviously a lot of women with endo through their pregnancies, and they often find, you know, they're so aware of their pelvis. They know what things are happening. They're very aware of where there might be scar tissuing or pulling or things like that. So it's very common to feel that at the front, but then feel tension at the back in your lower back. So for endo women, I can't emphasize your breathing pattern enough. Doing some, you know, laying down, practicing that breathing right into the pelvis to help with the pelvic floor. You're going to need to do a little bit more of that. Really, really common for women with endo to have hypertonic or really tight pelvic floor, because it's a protection thing. This is a zone of pain, this is a zone of inflammation, and that's fine. But just doing a little bit more breathing work from your diaphragm down into the pelvis, but also doing a little bit of things like happy baby, opening the hips up, opening the tissues up, getting a bit of stretch happening, getting your lower back, you know, doing things like cat cow to keep that lower back moving as well is really good. It's hard without doing, like, as an osteo, I just want to get hands on and be like, oh my God, let me at it. But I can't. But there's definitely things you could do to encourage movement of that tissue. So happy baby, do your breathing, that I've put up a great video on that. And yeah, do a little bit of that lower back mobility, which would be good.
Thank you.
You're welcome, Dylan. Anybody else?
I just got a question.
Mm-hmm.
Just been getting this last week, getting cramps in my calves when I wake up in the morning. Basically, when I go to stretch before I get out of bed, and sometimes it can be really painful. Is that rolling on the tennis ball thing's going to help, kind of thing?
Yeah, 100%. But I would be doing it. I would be really trying to counteract that by doing it before bed as well. So just while you're watching telly or something, before you go to bed, just rolling the ball under the feet. And then maybe before you get out of bed, doing a happy baby stretch. I mean, that's going to really stretch your pelvis and lower back, which then gives, if you can imagine a rubber band, when you get out in the morning, it's fully taut between toes to hips and pelvis. So if you do a nice big happy baby stretch and do a little bit of that before your legs hit the ground, that might give it a bit more of, you know, a little bit more give, if you want to put it that way. But yeah, you can roll, you know, do that and then sit up and roll the feet out a little bit. And I reckon you'll feel a little bit better with that.
Yeah. I'm just wondering, it's just really weird. I'm like, why do I just get it in my calves?
Yeah. Yeah. It's just because of how you've got to think, you know, just so much tension through your body and your hips are rotating forward. So your glutes, your hamstrings, and your calves all work together, and that's where they're going to be the tightest. Plus, you haven't been walking around warming that muscle up all day and providing circulation to that muscle or blood flow to that muscle. It's just gone constricted and tight. That's all it is. So if you can get some blood flowing in there, and plantar fascia rolling is the best for that.
Cool.
Try it.
Thanks.
There you go.
Yeah, I think we all know conceptually that our whole body's connected, and that, you know, the knee bone's connected to the hip bone and the hip bone, you know. But I think pregnancy really forces us to realize how much everything's connected. And like Bron said, you know, you may be having pain in one area of your body, but that really means it's another area that's tight. And, you know, just like she said at the start, if you can just be a bit mindful about where you are feeling tight, and just trust your knowledge about your own body, and, you know, work your way through some of the stretches that she suggested, and you'll find your favorite to be like, oh yeah, that is the one that really, you know, makes me feel good, helps me loosen up. That other one, yeah, not so much, you know. So again, so don't feel like you have to do every single thing every single day. Just sort of take from this what you need, and if you can add, you know, a few new little isolation habits. Look, you know, I think I saw one of those memes. It was like, you know, isolation without kids was like, I'm gonna garden and rearrange my wardrobe, and, you know, isolation with kids, it's like, I want to pee once with the door closed in isolation. So anyway, so for those of you who don't have kids, this is a perfect time to, you know, get to know your body, do some extra stretches, just add some new little habits to your daily routine. And I think, you know, in some ways, because we're all coming up with new daily routines, it's like a perfect time to add, like I said, create new habits, and add new things, you know, into our daily lives.
Yeah. And Kate just also mentioned that she started taking magnesium powder again. My fave. Good girl. Yeah, it's pretty good for cramping, muscle cramps. So, and it solved her calf cramping. It is essential to keep your electrolytes up. So I often say to women, try and have like a hydrolyte or something every day. Coconut water is great for that as a natural source, and so is watermelon. But because you just need that. You need extra things like magnesium, your trace elements and minerals, so you don't end up with tissue tension like that. So I often say, if you haven't had much water, you've been breastfeeding all day, you haven't touched water, go for your hydrolyte or gastrolite or some coconut water or watermelon, because it's going to get that hydration straight into your tissues. And I really am a fan of magnesium powder over the tablets. I don't know if my sister wants to chime in as a pharmacist on that, but I just think it's a lot quicker acting, faster acting, and I think it's really good to have it before bed as well, so you've got 8 hours of it to be absorbed properly into the body, and that, you know, it's a good little routine to get into as well.
I was just going to ask, could I just ask what brand of the powder? Because I take the tablets, which I found made a really big difference with all my like carpal tunnel. I had like de Quervains and stuff like that. But that like I pretty much always say magnesium changed my life.
Yeah.
But yeah, I only take the tablets. So is there a particular brand of powder that you recommend?
Yep. I usually don't recommend most things that are at the pharmacy. I usually recommend Bioceuticals, which is at most chemist warehouses, but it's going to be out the back because it's a practitioner only recommended brand. You've got to be really careful, and I'm speaking a little bit just kind of out of my scope, tiny bit. You've got to be really careful about using tablets that are just like Swiss multivitamins and ethical nutrients, because you've got to ask, where does that come from? How is it, you know, broken down? Is it a Chinese herb? Like, there's lots of different things you've got to be concerned about. Bioceuticals, I think, are an Australian company, but it's the quality of the supplement as well. So quality over the price, you need to pay for the good one.
Can I jump in there?
Yes. Go for it.
The magnesium made by Sandra Cabot is excellent powder, and you only need a tiny amount. Lasts forever. and it's very easily absorbed. Also, there's an Australian company called Amazing Oils, and
I love
they
them.
they make topical oil for like sprays, bath soaks, all of those sort of
Yeah.
things, and you can open your own account with them and have it within days. So both of those I get online, and I used to own a pharmacy, and I actually started stocking Amazing Oils, but Sandra Cabot's is straight
There you go.
online.
That's good.
Um,
Cool.
and it's excellent. So, but if you can't take the powder for some reason, which is generally very safe, and you work your way up to a tolerable dose, but if you can't take the powder, grab the Amazing Oils and give your, I can't remember who was having the calf muscle pain, but giving your calf muscles a good massage at night with that before bed does really counteract that calf pain in the morning, because I'm from endo as well, on my Achilles, and so I have to use it. Yeah.
Oh, I think Jessie has Jessie's. I think she might be Jessie that I know who's a nutritionist. Ethical
Is Sandra
Nutrients.
Cabot's flavoured. There's 2 different flavours. One is a citrus, and I can't remember what the other one is. I think they are both flavoured.
That's good. I wish someone would come up with a better flavour magnesium. Seriously, just on the down low. That's just all really weird. They're all not great. Jessie is a nutritionist, and she's just mentioned Ethical Nutrients is made by Metagenics, and their formulas are usually identically to the packed-only range, low excipients. Thank you. That's good. It's good to know. Lovely.
Cool. Any other questions? No? Okay. I think, Bron, you're in the Facebook group as well.
I am. Yeah.
I'll put the PDF up in there.
Cool.
If anyone's not in there, then just email Bron, and she can get the PDF to you. And if there's any follow-up questions, just reach out to Bron. I'm just telling, just email her, follow, find her on social media. Bron's very always very helpful and always very willing to support women.
Yes, definitely ask questions. You can also definitely put the PDF up on the Facebook site, but I've just kind of over the last few days got into the back end of my website, being a tech head like I am, not. But I got in the back and I've been able to kind of attach it through Instagram. If you go to my little link in my bio to links, you click on that and it comes up as pregnancy and breastfeeding tips. So if you know girlfriends that are on social media, just say Bron's put up the PDF from today just through her link in her bio through pregnancy and breastfeeding button, and you just click that and you've got the PDF. So if you know anyone who couldn't make it today or whatever, that resource will be there. Or if you need to access it, it's fine. Yeah,
and we did record this. So I'll put the recording up in the Facebook group and then send it to Bron as well. And if you guys want other, I'm hoping to do this with different practitioners, so just let me know what would be helpful for you, and I will see what I can line up.
Yeah, that'll be good. Definitely do the LC one. That's so good.
Yeah,
that'll be great.
Yeah, I think we'll tap Becky for that one.
Yeah.
Cool.
Thank you, everybody.
Right. Yeah, and like I said, just reach out if you need anything. I think there's so many of us practitioners who are wanting to support women. We know this is a really hard time for you all, and we want to help. So please, this is not just just let us know how we can help. This is an actual, we really want to help, but we need to know what would be helpful for you, because while we've been pregnant, we've been breastfeeding before. I've never been pregnant or breastfed through a pandemic. So yeah, let us know what you're worried about and how we can help.
100%. Just reach out.
Yeah.
Lovely.
All right.
Thank
I'm going
you.
to stop recording and say goodbye.